And thank you to Education for Health for supporting us with this webinar. Really exciting to be here. And what we're going to be talking about today is managing common ailments at home and how you can become more self-care aware. So yes, I am representing the Self-Care Forum along with some other colleagues that I've got with me today, and they will introduce themselves. So I'm Helen Donovan, I'm a registered nurse, and I'm also the chair of the Self-Care Forum. I work separately as an independent nurse consultant and really delighted to be able to do this session. Before we start, I think Laura said some of these things, but if we can make sure that everybody is on mute throughout the presentation, even extraneous noises can be quite off-putting for other people. So if you can press the mute button. If you'd like to ask a
You're muted, Helen.
Oh, did that suddenly mute, or have I been muted the whole time? So
No,
sorry
it just
about
suddenly
that.
muted then.
Okay, I must have been talking about mute and must have pressed the mute button. So please just to note as well, when we do have the questions, this is about managing people's understanding of self-care. So we won't be answering specific questions about individuals' illnesses and symptoms. So just to be aware of that. As Laura has said, we will be recording this session and it will be available on the Self-Care Forum's website. If you're having any technical questions, please again send it through to the host, and Libby will be managing that. And we really want your evaluation. Really so pleased to see the pre-webinar evaluations. They were so useful, and hopefully the sort of post-course and the sort of follow-up evaluations. So please do remember to do those when they come through. So what we're going to talk about today is hopefully give you a bit more of an understanding of what we mean by self-care. And I know from the pre-evaluations, a lot of people have a very good understanding, which is great, but hopefully we can expand on that. Appreciate why self-care is important to the wider health and care system, be able to identify symptoms and common ailments and how long they last, so you feel confident to self-care or support people to self-care. Know when to seek professional advice. Obviously, that is really important. And also, we're going to spend a little bit of time considering what makes us as individuals, as human beings, adopt certain health behaviours. So the way we're going to do the session is, obviously I'm giving an introduction, and then my colleague Addie Williams, who is a pharmacist, is going to talk about winter wellness and our new fact sheet. And then my other colleague, Dr. Pete Smith, is going to talk about the other new fact sheet that we've got, which is winter illness. So the two go together. And then Trevor Gore is going to talk about behaviour economics and those sort of behaviour changes, how we sort of, how we do what we do, if you like. And then we're going to have an opportunity for questions. So just to give you a little bit of a background about the Self-Care Forum, what is the Self-Care Forum? We're a UK charity and we're a coalition of different stakeholders from professional groups, patient and industry, all working together. And our aim is to further the reach of self-care and embed it into everybody's personal and professional lives. We aim to have practical, pragmatic approach to self-care. We have free resources and they're all evidence-based. And the other aim is to raise awareness of self-care. And there is the link for our forum on the bottom of the page. So the Self-Care Forum aim is here on this slide, and it's the actions that individuals take for themselves and on behalf of or with others in order to develop, protect and improve their health and well-being and wellness. Now, along with this, we've developed the self-care continuum, and this is really explanatory of what we mean by self-care, which really covers everything from those daily choices and well-being and wellness through to full professional support. And I'm going to come back to this in a minute. we're also really keen to make sure that people realise that self-care doesn't mean no care. It's not leaving people to just fend for themselves. Support for healthcare comes from professionals and others in order to make sure that people feel confident but also safe in self-care. And to do that, we have our self-care week, which always happens in the middle of November every year. We have a range of self-care fact sheets, 24 with another 2 coming along line. And we've got e-learning resources that we've developed, and we do a lot of collaboration with national leaders, influencers, and continuous awareness raising. And we also have our self-care innovation awards, which we have every year and announce at Self-Care Week. So what is the research telling us, and how does this inform the work of the Self-Care Forum? Now, going back to the continuum, and before anybody says, no, I haven't messed up the slide, the reason it's like this is because most of what happens is at this end of the spectrum. But when we sort of break it down, if somebody has a long-term condition or has an illness, they may get up to 10 hours of professional contact if they're managing a long-term condition. That still means they've got 8,750 hours which they are using as self-care. So how can we make sure that that is managed well? So it won't be 75 years of the NHS. Today is the birthday of 75 years. Lots of work happening at the moment around how we can improve the NHS. And this sort of line, if you love the NHS, you need to love yourself as well. We need to work together to really help the wider health and social care, but particularly the NHS. So from a self-care Forum perspective, we're really proud to support the NHS in helping people to self-care. So one of the other things that we've seen is that when you look at Google search, and this is particularly from looking at it post-pandemic, if you look at the figures in 2017, you saw sort of over 331 million Google searches, 220 that went up to the billions, 3 billion, and then 2022, 5 billion. So a real increase in people looking for information. And the other thing we know is that this is the tip of the iceberg. What people actually seek out there from a healthcare professionals, a lot of the time they will do nothing, or they'll talk to friends. They might seek information off the internet, or they may go and get over-the-counter medicines and not speak to a pharmacist in doing that, just buy stuff. Only 8% will visit their GP, and this is based on some research that was conducted in 2011. So before I pass over to Adi, we've got a whole range of self-care aware fact sheets, and these are designed for individuals to use, but also for healthcare professionals to use when they're sort of supporting people, and for other people within the wider health and care system to use to support other people. And they get a lot of use. We got lots of downloads, and we also have a lot of what they call backlinks. So GP surgeries have them available to use during their consultations. These are the 2 new ones for 2023. As I said, Adi is going to talk about winter wellness, and then Pete is going to talk about winter illness. So Adi, over to you, and I will move the slides as you tell me to.
Thank you very much, Ellen, for very detailed and really very helpful introduction to the Self-Care Forum and the work that we do. For everybody listening today, just to introduce myself, my name is Adi Williams. I'm a community pharmacist based in Bristol, in South Bristol, Bedminster, and it's a real privilege to also be a Self-Care Forum trustee as well, and also to be introducing to us our new straight off the press winter wellness get ready fact sheet. So thank you very much. So we're going to go through that, and I'll go to the first one there. So the first thing to tell you, as Ellen would have already alerted to, is that all our fact sheets go through a very rigorous preparation process, which involves how we get fellow clinicians and wider members of the public, so who are also called Self-Care Forum champions as well, to help us in looking at the information and giving feedback on what we're trying to say. For the winter wellness fact sheet, we have adopted the acronym Get Ready, and Ready really talks about what we want to communicate through this particular fact sheet. And what the aim of the fact sheet is to really not just talk about the fact that winter is coming as it is, and why are we really speaking about that in July. It's to create a sense of readiness. It's to also get a sense of preparation. It's for us as members of who as people who have responsibilities or sphere of influence in health and wellness, to really start to look at, for ourselves and for the people that we take care of, what are the steps that they need to take, in terms of that. So, and as the points we go through we start to expand on them, I think for many of us, it will also give us a good ticking list as well of things that we need to be thinking about. So the first thing on the READY acronym is to remember to plan, and we'll be expanding on that. The next one is energy and warmth, which is certainly not something that is far from everybody's mind at the moment, with the current sort of ongoing conversations around energy cost, and rightly so. We'll be expanding on that and how it affects your winter wellness. Ask your pharmacy team. I think no member of any NHS a publication or role now seems to complete any statement without talking about pharmacy. But in this context, we really want to talk about how the pharmacy team can play the right and critical role in winter wellness. Diet and nutrition, again, the key topic area, really around also the current crunch in people's spending power due to the cost of living pressures. And most importantly, and actually just again to follow from where Ellen ended her conversation with us earlier, is the importance of you as a person and why you matter, and the steps that you can take to protect yourself. So we're going to go to the next slide, and we're going to be talking about remember to plan. So what is it that we're talking about? It's so easy for any one of us to forget that when the seasons change, it catches us out. We know, however, that for those that have particular vulnerabilities, either because of ongoing health conditions or their age, that when the weather changes, or actually young children as well, it can present its own inherent greater risk for them. So for us, we want to remember those people as we think about getting ready, maybe mentally, to think about maybe ways and roles that we have and how we're going to communicate or make sure that this fact sheet is made available to them. Key thing to remember in that sort of context is thinking also about clothes, remembering that especially now more than ever before, the way the weather changes, it can feel very warm and sunny one day, and really you're down in the low temperatures. So you need to get the suitable clothes ready, and also reminding people and helping people to think about layering up as the best way. It's also good to start to think about planning for your heating service and heating system and getting that service done. I'm sure that all heating engineers know that come the first dip in temperatures, boilers refuse to start up and their phones start flashing up. So maybe it's a good thing to remind people to think about that. Also to think about medicines as well that people will have in their first aid cupboard for common ailments, which your pharmacy team will be more than able to help. But we do make some suggestions of some simple ones that we think everybody should be thinking about: painkillers, paracetamol, ibuprofen, indigestion treatments, and a first aid kit that's fit for purpose. We should have at least a thermometer, plasters and bandages in there. Key message as well for us to reiterate is when you get that invitation for your NHS flu vaccine or COVID booster jabs in the autumn, which will be offered to those eligible in the as a free service, especially, please book in immediately and get it done as soon as possible. The NHS invites you for this because you're deemed to be most vulnerable, and sometimes people will ask that question: do I really need to go, or can I delay it? And we may have the opportunity to help to reinforce that message. Talking as well about boilers and testing of those your heating systems. is a good tip is to remind people that many of the energy providers will offer some sort of assistance as well, and many of them will throw in a free engineer's visit. And if that's available for you, please get it and get it done now before you're stuck with your hot water bottle sitting on the couch with a few blankets because you're freezing, and that's definitely not good for your health or your well-being. The next slide, please. So energy, yeah, rightly following on from scaring people about how to make sure you're not facing a boiler crisis, is key to remember that, not least because of the cost of energy and how it's impacted on all of us, is that there is, what we know to be the best, or the healthiest sort of temperature to be around for your health and well-being. And that's usually, we say stay in a room that is warm enough, about 18 degrees there. I know that in the old days, maybe before that spike in energy costs, there used to be fights in some households about how high the thermometer should go. I'm conscious that sometimes now it is about how low it needs to be, but we must make sure that we are encouraging people to stay in warmth. We are encouraging them as well to use things that can be energy efficient in their own way. And there's lots of information as well about that, but we're talking about using sometimes like hot water bottles, even electric blankets and heated throws to stay warm at night, and also about how to manage yourself keeping warm during the daytime, because the sun may be out but the temperature can still be relatively low and you could feel very cold. It's usually much cheaper and more environmentally efficient to keep out and make sure that you use some of these things rather than turning up the thermostat there. But if you do have to stay indoors, please remember that you need to still think about being active, not just sitting still, and just reminding people about the importance as well of moving around. Not only does it boost their blood flow and help them to stay warm, but it's actually good as well for energy levels and the mood as well there. Again, we've mentioned earlier about clothes. Clothes are quite important, layering there, and not remembering to get a good hat and a glove as well to keep your head and arms warm there. These are important, and energy efficiency is something that has really taken over a lot of the conversations in many of our lives now. So really looking at reducing the draft in the houses, making sure that our window frames and keyholes and on the doors are blocked to stop cold air circulating through them, using the curtains as well to help to conserve heat and also to bring in light and warmth into rooms. Those are important. Again, most energy providers and actually most local authorities will have a whole lot of information around this, including some grants and money as well that can help towards the cost. And please be willing to steer people towards this, and maybe in your if you have a practice area or an area where you provide care, getting some of that information, even inviting them into the space to come and do open days and share would be helpful. Now, as I mentioned, it seems as if the appreciation and the need of the community pharmacy teams to play a key role in how the healthcare functions has never been greater than it is at the moment. And the key thing to remember in this is that community pharmacy teams can advise on common ailments and diseases, as well as how to help people make the most of their medicines. But a key bit of the great asset that they are is that they offer access to trained and experienced healthcare professionals that can help you to keep you and your family safe during the winter months. So how do we use this? The pharmacist's clinical expertise and skills are certainly one that the NHS continues to be very key to use. But remember that behind every pharmacy is not just a pharmacist, but there's a whole team of trained professionals working within their own scope of competence, able to work together to deliver care. Use that knowledge to help yourself. Coming in there to access what we expect in September to be the new NHS Common Ailment Scheme, coming in when you have queries about winter ailments, managing your medicines cabinet, discussing worrying symptoms as well. They will be at hand, ready to help you to discuss some of those things there. Next slide, please. Next slide, please.
I have.
Oh, Oh, beg your pardon. Sorry, it's my one slow on my end. I beg your pardon. So we're now talking about diet and eating, and a key part of how we will stay warm and healthy in the winter months is certainly going to be our diet. And with the cost of living financial crunch, which we know disproportionately affects those on a lower income, or and actually also those that are already likely to be having living with some form of health or a disability, it is important that we do reiterate the key messages about what is a healthy, balanced diet. The 5 portions of fruit and veg daily, that helps also to strengthen our immune system and keep us warm in the winter. Things like trying to take regular hot drinks and foods such as porridge, soups, and stews. Now, with all this said, we must also realize that now more than ever before, we need to give people practical solutions. We need to talk about the fact that frozen or tinned fruits and vegetables, where there's no added salt and sugar, can be healthy for them. It can be affordable, sometimes more than the fresh produce, which they may find that is out of their budget range. We are not saying that, that this is a better option, but what we are saying is that there are options there and that you can have. And we want this information in the fact sheet to empower people. We want to tell them about the possibility of being able to cook healthy meals as well on a budget. And we know that many of the leading chefs now post their recipe ideas around this online, and you can also access that sometimes from food banks. And it's important as well that we do realize that when we are not we have to appreciate the fact that sadly for us as a society, many people are relying on food banks, and we want to help to destigmatize that. We want to say that actually, there is no shame, there is nothing wrong if that is a way of you being able to access the food that you need, but also to encourage them that while they're there, take advantage of the fact that many of those food banks will also have information about ways to cook in a more energy efficient manner, and also have sample recipes, or even sometimes do cooking classes, just again to help along the same thing. Key message is there about vitamin D as well, which we know because of the type of seasonal weather that we'll be experiencing in those winter months, you can find that you are in need of supplements from this. So 10 microgram a day is 10 micrograms of vitamin D during the autumn and winter is recommended. Your local pharmacy team or GP will be able to advise you on the right level of supplementation for yourself, which particularly for people that are spend more time indoors or have darker skin, there would be more at risk of that. Now, finally, one of the things that we know is that as we come into the winter months, darker days, more time indoors, it's not unusual for those feelings of loneliness and isolation to bring to not just make you feel very much isolated, but also to make you feel very low, especially if your vitamin D levels are also depleted as well. So what do we say? We want you to know that it's okay to reach out to organizations that can support you. You can find this in your local areas. There are lots of local befriending organizations there, schemes that are out to try and get people to increase social interaction. For yourself or for you talking to somebody else, what are the things you can tell them to think about? Volunteering, going to the local library, community centers, social media as well, reading newspapers, contributing in a positive way, engaging on social platforms where the conversations are uplifting and fun and educational are some of the ways there. But volunteering especially helps to reduce loneliness, and it gives you a real sense of purpose because it allows you to connect with local groups, and you get worthwhile benefit as well from the sense of you are helping to be part of a greater good. Simple actions as well, donating excess food or drinks can help you to feel a great sense of fulfillment. And managing stress, particularly during the winter, is so important. And not only does it impact on your well-being, it also means that it helps your immune system because it protects it. And the hormones that we know that cause stress, we also know can also suppress your immune function. So you're more likely then to also feel unwell because of the added sort of stress and pressures that you are facing, including its impact as well on your blood pressure. Look out for things that you should not use as a comfort, such as sugary drinks or snacks or alcohol as well. And remember, being active, going out for walks, spending time with family and friends, making the most of the sunshine whenever it's out there, to try and enjoy it, are some of the things that will boost you, because ultimately, your health and well-being is what makes you not just to survive those winter, but also to thrive as well. I'm going to hand over now to Dr. Peter Smith, who will take us through the next fact sheet that we've got in this series.
Good afternoon, everybody. Can you all hear me? Thank you. So, Ade, thank you for that. That was absolutely marvelous. Thank you. Since we first started deciding we were going to concentrate on winter wellness, we were aware that despite the fact that you could do everything that Ade's actually mentioned there, people are going to catch winter illnesses. So what we wanted to give you was the full armory of information to deal with winter illnesses as well. And my background, as you can see, is as a GP for 30 years, and I'm currently president of the Self-Care Forum, and I do some academic things as well. Now, when we know that when people come to our website, and you'll find there's lots of information there about self-care, people aren't necessarily sure what condition they've got. So what we want to do is to bring that all together so that you have summaries, and you can start to say, well, one of these may be what I've got, but it may be that you start off with diagnosis, one sort of diagnosis, one idea, you change to something else, because there are overlapping symptoms, aren't there? You can get a cough with cold, COVID and flu. You can get a temperature with flu, sore throat, or even the norovirus that we're actually referring to. And there is no real one sort of killer question that says this is definitely this condition. But we know that people are sensible, and we know that people, if we give people information, they can make their own decisions. And that's really what we've done consistently since we started many, many years ago. And we know that that's going to work this time as well, because the reality is we take information we've got, we make a kind of sort of interim decision, and then we can change that a little bit further down the line if the symptoms change, and we can change our management. And here's a secret: GPs do that all the time. They get the information, as much information as they can get, and then they decide on a working diagnosis, and that can change, and the management can change as other symptoms develop, or as we discover new information. And here's the thing as well: people have been doing that since the year dot, and I can guarantee that when the first Homo sapiens 200,000 years ago got their first cold, they didn't ring 111 or go to their GP. They had to manage themselves. And if you look at those amazing percentages that Helen mentioned earlier on, we manage these things ourselves, and people always have done. Only 8% at that stage would actually go and see their GP. That was 12 years ago. It may be less now that we actually have the internet as well. Hopefully that'll be repeated at some point. But the other important thing is what we emphasize throughout the whole of this. Let's not infantilize people. Let's give people the information. But we also have to say there are certain times when you should be seeking help, and there should be people there to help you at that particular point. Could we go to the next slide? No, I hope you'll download the fact sheets and read them. I'm not going to go through. I'm not going to go through every single word of them, but I'm just going to pick out some of the highlights. So first of all, you'll notice that we tend to use the term minor illness, as is happening nationally as well. We don't really, we do not use the term minor illness. The reality is that if you have a cold or flu, you feel ill. Suggesting that it's minor is not what you want to hear at that point. You feel ill. But for each of these illnesses, there are 4 basic questions to ask. What symptoms can I get? How long is it going to last? What can I do to help myself? And when should I seek help? So we've done that for each of these conditions. And this first page basically has 3 symptoms rather than any specific sort of diagnosis or condition. And it's cold, sore throat, and cough. So how do you know when you've got a cold? This may sound a very basic question. The reality, it's all nasal, isn't it? It tends to be a blocked or runny nose, sneezing, perhaps coughing because it's dropping down the back of your throat, a sore throat for that reason as well, and a slight fever. But if you have a high fever, it probably isn't a cold, or you have a complication, but you're still going to feel pretty rotten with it. And it may sound obvious, the advice, but it's amazing the number of people that used to ring me and ask basic advice on cold, that you need to rest, you need to eat healthily, you need to drink plenty of fluids and take paracetamol, ibuprofen, whichever is best for you, to help with the symptoms. You shouldn't be exceedingly unwell with a cold, and it may last up to 10 days. But if it's going on for more than 3 weeks, you should be seeking help. But of course, if you have an underlying condition, you have a high temperature, or there's other reasons why your immune system is weakened, then you should be seeking help sooner. And of course, if other symptoms develop that are not standard cold ones, if you're getting chest pain, coughing up blood, you have difficulty breathing or swelling of your glands, then you should be getting in contact. So that's the basics of a cold. When we come to sore throat, you can get a bit of a sore throat when you've got a cold, but you can have a sore throat purely by itself. Now, we talk about strep and viral sore throats. The reality is that whichever is the cause, it's going to last about a week. And you'll notice a lot of these, when we say how long these things last, they're perhaps a little bit longer than we might have been taught when we were youngsters. The reality is they can last some time. And the same sort of sensible advice applies with sore throat, but you can also suck lozenges or ice cubes. Gargling with warm, salty water is a good idea, but not with children because they tend to choke, so don't do that with the children. But whether it's strep or viral, as we said, it can last about 7 days. If it's going on beyond, say, 10 to 14 days, then you should be seeking help. And again, if you have severe problems with swallowing or severe pain, you should be seeking advice. And again, if it's a very high temperature and you're feeling hot and shivery, it's also worthwhile seeking advice there. And you can see some of it, there's still overlaps between these different symptoms. And when we're coming on to coughs, they're common, aren't they? 1 in 5 people are going to get a cough over winter, and children will get several a year very often, and they can last up to 3 weeks. I'll come on in a couple of seconds why we say it's 3 weeks, and then you need to be seeking help of some kind, even though you can get a post-viral type cough, which can last up to 8 weeks, but that isn't a diagnosis people should be making for themselves. Now, a lot of people will take over-the-counter cough medicines, and they feel that help. That's wonderful. Ibuprofen and paracetamol can help with the discomfort as well. But obviously, if you're coughing up blood, getting chest pain or breathless, as we've said previously, then you do need to actually seek help. The other thing is, if you've had recent weight loss, say over the last 6 months, and you're starting to get a persistent cough, then you should be getting in contact, as you should do if you're getting any hoarseness or changing in your voice. I'll go back to the issue of the 3 weeks because it's a little bit of a grey area, because the NHS recommends that if you've had a cough for more than 3 weeks, you should be getting in contact with a GP. And the reason for that, and it's particularly older people, ex or current smokers, because it's thought that beyond 3 weeks that there's a risk of lung cancer. And if you have a cough that lasts more than 3 weeks, no one's going to tell you off for going to see somebody at that stage. It's very likely it's not going to be a problem, but NHS definitely recommends that you go after 3 weeks. Could be on the next slide. And then we get on to perhaps a more potentially serious condition, starting with flu. And yet, how do you tell the difference between cold and flu? There's the old adage, which we're taught, that if you have one of these conditions and you're standing on the edge of a field, and in the middle of the field, it used to be a £1 note, but because inflation, it has to be a £20 note now. If there's a £20 note in the middle of the field, if you've got flu, you won't go and get it because you just feel so unwell. You just don't want to do anything at all. People are really unwell with flu and they have the high temperature. It's different from a cold. If you have any sort of underlying condition, again, it's important to get in contact sooner rather than later. And here's the most important bit of advice. Make sure you get your flu jab if you're eligible for it. because it not only does it protect you, it protects people around you as well, because you're not going to pass it on to them as well. So if you feel that you've got the flu, then again, it's that sensible advice of resting, drinking fluids, taking paracetamol and ibuprofen, and taking particular precautions to make sure you're not passing it on to anyone else. Now, we know what those are because we've all been through the COVID process, but that's particularly important with flu. And those awful symptoms should be improving after just about 7 days. But particularly if you have a younger child, if you're over 65 or you're pregnant, then you should be getting contact sooner rather than later. And the same if you've got a long-term condition, or perhaps you've had chemotherapy recently so that you're affected in that way. And of course, if you start getting the other symptoms we referred to earlier on, if you're coughing up blood, difficulty breathing or chest pain, then you should be getting in contact with a GP or calling 111. So you can see there's a pattern emerging here about when to seek help. It's actually when it's not got your standard simple symptoms, and it's when these are actually getting severe. Could we have the next one? And of course, we all know about COVID because it's affected all our lives for so long. And we need to be mindful that it's still there. COVID is still around. Now, if you're one of the people who is eligible for all the sorts of interventions associated with COVID, you have probably already been aware of that because somebody from the NHS has contacted you. If you're not sure, then if you go onto our website and click on that link, that COVID link there, there's a list of people who are eligible. It's exceedingly unlikely that you haven't been contacted already. I'm not going to go through the list because it's about a page long. But remember, there's those other symptoms associated with COVID: the loss of taste or smell, that continuous cough, which was very sort of typical of COVID. And you can get those other symptoms, can't you? If you remember the diarrhea that a lot of people got with COVID as well. So there's a variety of different symptoms. And I said some people will be eligible for for vaccinations and for treatment as well. So, but if you think you've got COVID, it's still, you should be staying at home if you have a high temperature or you don't feel well enough to go to work. And that kind of applies to most common illnesses. But other than that, you can be up and about. This is not during the COVID pandemic anymore. And you remember all the advice about, if you're feeling particularly unwell, if you're unable to manage, if you're worried about a child under the age of 2 years, then you should be getting in contact with a GP or ringing 111. And then finally, the last thing, which is not a respiratory virus, is that norovirus. And now this is the only one that's not respiratory, and it's often called the winter vomiting bug, but in fact it's beyond that, isn't it? Because I don't know if anybody's had this, but the reality is that it's also the winter diarrhea bug when you've got it, and it does make you feel ghastly. And the other thing about it is it's extremely catching. So all those COVID precautions need to be taken, and more as well, because of the fact that it's so catching. And obviously, it's even more important to make sure you get plenty of fluids if you're losing those fluids. But if you get blood in your diarrhea, or if your symptoms haven't improved after a few days, then it is important that you get in contact. If you're feeling extremely unwell, then you should be getting in contact, despite the fact you might think it's norovirus. Now, there are other, so this is sort of a summary of the winter illnesses. There are other fact sheets that we have, and they cover sore throat, cough, fever in children, common cold, sinusitis and strep A. But and they're there to inform you, empower and inspire you. And the final section, which we haven't put up here, is basically how to get in contact with how to look for the further advice, either through the NHS or through the Self-Care Forum. So that's a very, very quick whiz through winter illness. Now I want to hand over to my very good friend Trevor Gore, who has some wonderful insights into why we do what we do and why we don't always do what we should do. So over to you, Trevor.
Thank you very much, Peter. A thumbs up from somebody that you can hear me. Thank you, all those thumb people. I'm delighted to be a trustee of the Cell Care Forum. I'm also an associate director of the Institute for Collaborative Working, because everything we do with healthcare has to be a collaboration. And I'm an honorary member of the Royal Pharmaceutical Society. I first became interested in behaviours. I used to be a salesman many years ago in the pharmaceutical industry, and I'd tell doctors all about my wonderful new product, and they'd go, "That's very interesting." And I'd say, "So you're going to use it?" And they go, "No." And I'd say, "But you just agreed it's better than the thing you're already using." And they say, "Yeah, but my patients are happy with what they've got, so what's the point?" So it was at that point I realized that people aren't always the most logical beings on the planet. Next slide, please, Helen. So I went away and got a degree in behavioral psychology to find out why people do what they do. And this has been evolving over many years. I put the new in the new science of behavioral economics in inverted commas because it's not new. Daniel Kahneman, who wrote the book Thinking Fast, Thinking Slow, won the Nobel Prize for Economics in 2002. So this is over 20 years old, this thinking. The extraordinary thing about Daniel winning was he's not an economist, he's a psychologist, and he realized that we're not rational creatures. The book was published in 2011. We've known this for a long time. Next slide, please, Helen. But we believe that if we give people health advice, they'll go away and take it. Or if people know something's bad for them, they'll stop doing it. And the evidence of our own eyes tells us that's nonsense. You know, we see people smoking, and you know, thankfully the rate of smoking has gone down, but there's still people doing it, and they know it's bad for them, but they keep doing it. And I'm sure all of us on here have got some behaviors that secretly think that's bad for us, but I'll keep doing it anyway. And Helen mentioned that 8,750 hours a year we're not with healthcare professionals. All these behaviors are happening outside of the medical care setting. They're happening at home. So behavioral economics tells us, or gives us ideas of why people do what they do. Next slide, please. Now, you might think that if people are behaving strangely, what hope does it give us? But in the middle of that, it says, but in highly predictable ways. So yes, people are illogical, but we know where their illogic is going to be and the likely things it does. And this is now sort of spreading across all of the world and many industries, not only healthcare, advertising and market research. The great David Ogilvy said, consumers don't think how they feel, they don't say what they think, and they don't do what they say. We're not the most logical creatures out there, and the number of companies that have launched products that they've talked to their consumers who've said yes, I'll buy it, and then they don't. We aren't very good at accessing our own thoughts and motivations and behaviors. Next slide, please, Helen. And this leads to the action intention gap. Yes, I have got the world of best intentions and I'm going to do all these great things, and then we don't. How many of us have started the diet on January the 1st, and by January the 5th it's not going quite as well as we'd like? We're going to join the gym. If everybody who took out gym membership at the beginning of the year actually turned up at their gym, the gyms couldn't cope. Their business model is based on people not doing what they said they were going to do. And unfortunately, that happens in healthcare far more than we'd like to admit, that people don't do what they say they're going to do. Next slide, please, Helen. The best medicine, and medicine's in inverted commas because it might not medicine in the traditional way, but a way of looking after yourself, is the individual who's informed, empowered, and inspired. And that's what we try and do at the Cell Care Trust. We give people the information so they can make their decisions. As Helen said right at the beginning, self-care doesn't mean no care. And as Ade said, the pharmacy teams now are really there to help you, to give you the information, to empower you to make decisions that work for you, and to inspire you to think that you can do something differently if you want to do it. Next slide, please. There are three major reasons why people don't change. The first one's lazy, and I don't mean sitting down on the couch and not doing it. It's more apathetic. Oh, I could change, but I'll do it tomorrow, or I'll do it the week after. Or, I'm not sure I want to. Then there's confusion. What actually do I do? There's a wide range. Helen mentioned at the beginning, you know, people, you all really not kindly filled in the evaluation. People's idea of self-care is everything from looking after yourself to sitting in gardens and meditating and taking photos. People are really confused, not just on self-care, but on all aspects of their life. What should they be doing? Because the data changes all the time. And finally, they're scared. What if I get it wrong? This might be too difficult for me and I'll fail. And those are the three major barriers that people need to overcome, and we need to help people live more healthy lives. Next slide, please, Helen. The middle one of that is confused, is really interesting. So everybody who tries to give you information thinks the more information they give you, the better it will be, the easier it will be to make a decision. And that's been proven to be nonsense. I defy anybody to go into their local supermarket and look at the toothpaste section, and you scan it and there are 20,000 different toothpastes, whitening and tartar control and breath control and tongue control and all these things. And it's just so confusing that what the majority of people do when given that choice is they buy what they bought last time, or they buy what's on offer. Because too much, it's called the paradox of choice. Too much choice makes it harder to choose, not easier. Going to a restaurant, if there's a wine list that's got more than 30 wines on, you buy the one you had last time or the one second from the bottom because you don't want to seem cheap. There's a really great experiment. Next slide, please, Helen. It's a really great experiment that shows this. There were two stalls set up with jams. One had 24 jams, one had 6. And the one with more jam attracted more shoppers. So you think, well, that's a good thing. Both of them, and the only one that had 6, sampled 2 jams. But the one that only had 6 jams, 30% of shoppers bought jam, where only 3% of shoppers bought jam where they had more choice. That's 10 times as many. Too much choice is confusing. So that's why in our self-care facts, we give a limited option of choices. As Peter said, there are 1,000,001 things we could tell you about, but that would just overly confuse people. Next, please, Helen. Another thing that's really important is context of the behaviors. You can all read that. That says ABC quite clearly. Next, Helen. You can all read that. That says 12, 13, 14 quite clearly. Next, Helen. The middle number never changed. You read it as 30 as B in the first one and 13 as the second one, but it's exactly the same thing. What's going on around you is as important as what you're trying to do, and a determinant. So what your family thinks about self-care. In healthcare, if you're on a medication chronically and you want to take it at the same time, we urge people to, take it every morning with breakfast and your evening meal. And that sounds a really sensible thing to do. Link it to a habit or routine. But when your habit or routine changes, i.e. when you go on holiday, you might be getting up later. You might skip breakfast. You might have a really late evening meal. So contextually, I would say, put your medicine next to your toothbrush, because you're still going to brush your tooth first thing in the morning and last thing at night. So that would be contextually more relevant than a meal, which may change. Next, please, Helen. The old carrot versus stick. Do we beat people to doing the right thing, or do we bribe them to do the right thing? Well, the reality is neither of them work particularly well. If you're going to beat people with a stick to do the right thing, the second you stop beating them, they stop doing the right thing. And if you're going to bribe them to do the right thing, the second you stop the bribe, they stop doing what it is you want to do, because there's no incentive in it for them anymore. So there are better ways, next slide please, Helen, than either beating them or praising them. It's a question I'm asking. I don't expect you all to answer. So which of these do you think would have the greatest effect? Telling people they'll gain 5 years of life quitting smoking, or they'll lose 5 years of life by smoking, or they'd have the same effect? Most people say, well, it's the same message, just couched differently. They'd have the same effect. Next slide, please, Helen. It's actually not true. You will lose 5 years of life by smoking is 2 to 3 times more powerful than telling people stop smoking and you'll gain 5 years of life. That's because of something called aversion bias, loss aversion bias. Slide, please, Helen. We don't like losing what we've already got. You'd be more concerned about losing £5 from your wallet or your purse than you would be that you might find £5 down the line. And the government know this. So this isn't a political slide, but the let's take back control was a loss aversion tactic. It was telling people, you don't want to lose something, do you? Let's have it back. It wasn't about looking forward to gain something new. It was, you don't want to lose it. And the reason, and Starmer did the same thing. And the reason the governments have started doing these things, the British government used to have a behavioural insights team. It used to be called the Nudge Unit. It has been spun off now and is independent from government. But they realise that to get the message out to people, you have to be quite clever and nuanced in what you say. Just telling people things doesn't often change behaviour. Next slide, please, Helen. How you couch and sell the message to people is just as important. I don't know if any of you are old enough to remember when the iPod was launched, this great new thing. They could have talked about its 5 GB memory, its rechargeable lithium battery, headphones engineered to do this, that, and the other. Slide, please, Helen. But what they actually talked about, it was 1,000 songs in your pocket. And that told you everything you needed to know. So how you couch your message is as important as what the message is. And quite a lot of people don't need all the technical information that we as healthcare professionals quite like to give people. We like to overload them with, this is how it'll work and this is what you should do. And sometimes they don't need that. They just need to know the what's in it for me scenario. How do I get the best out of this? Next, please, Helen. And there's an emerging world of metaphors, which is obviously medical metaphors. And lots of science has discovered that telling people about their condition or what they should do by relating it to something they already know about works. So when we're talking about hemoglobin, if people have got anemia or whatever, to actually liken it to it's a school bus picking up and dropping off kids makes it easier for them to understand the role of hemoglobin. Next, Helen. Talking about prostate cancer, it's like stepping on a hose. Again, Helen. Fiber in your diet, it's linking them in a medical way to things people readily understand. The next one I like, because we always talk about depression is like being in a black hole, but we stop there. Tell them medication can be the ladder to help you out the black hole is really empowering in telling them something. But we just say, oh, depression is like being in the bottom of a black hole, isn't it? Well, tell them what it's doing to get them out of that black hole. Next, Helen. This is really powerful on the NHS's 75th birthday. And we know all the pressures and things, but letting people know what the effects of their action will be. So if they did self-care for hay fever, we're in the hay fever season, and just went to the supermarket or the pharmacist and bought some hay fever products, it would cost the NHS or the person £2.50. If they went to the doctor, who had to write a prescription, and then you had to go to the pharmacist to get the medicine, it's 33 quid. If you end up in A&E, that's £65 for exactly the same medicine and exactly the same amount. So once people realise the effects of their behaviour on the NHS, and we all love the NHS, it's part of the problem, but they realise that actually self-care, it's easier for me, but it's also easier for my community and the country. Next, please, Helen, and the NHS. That's my final slide. I like it. We're a strange species. You know, these people are going to a gym, and that's in America, but I've watched people in the UK drive around a car park at the gym to make sure they get the nearest spot to the door. They've just gone to a gym. That tells me 3 things as a behaviorist. One is we're not logical, we're strange creatures. The other one is we're very good at compartmentalizing behavior, doing one thing that we know is wrong, but something's all right. How many of us go to a McDonald's and order a Big Mac with large fries and a Diet Coke? We're compartmentalizing behavior. We go, yes, I want all the fatty, unhealthy stuff, but I'll be healthy with my drink, so that'll be all right then. And the other thing it tells me is people like to follow other people. There is a herd instinct. So if there was nobody on that escalator, I suspect some people would use the stairs, but because other people were doing it, it gives us permission and validates that it's all right if I do the same thing as well. That's a very quick run through behavioral economics. So I'm going to hand back to Helen. Helen.
so much, Trev, and I thank you so much. I've heard those slides before, and I always find it so interesting. So we have got some time for questions, and please do pop them in the chat. And just while you're doing that, I just want to sort of reiterate, really, in any good teaching session. So we've explained. Hopefully, you'll have a better understanding of self-care and what we mean by self-care. You'll have appreciated why self-care is important to the wider healthcare system, and be able to identify the symptoms. I mean, those fact sheets, I'm really excited about those fact sheets, because we know that people quite like having those sort of really summary points to share with people, and you'll know when you need to seek professional help and advice, and be able to consider what makes us adopt certain health behaviours. So it's really interesting. Just before we go, though, please do remember we need your feedback. Part of these webinars is so that we get a sense of, how people sort of change their attitudes to self-care, and whether they can use this learning when they go through their other lives. And just as a final sort of reminder about the self-care forum, get involved. You can sign up to our newsletter. You can follow us on Twitter, Facebook, LinkedIn. My colleague Libby, who hasn't spoken today, but she is here, is amazing on social media. So do follow us and become one of our self-care champions. We have a whole branch of people who are self-care champions, from healthcare professionals to many, many others. So please do look at that. There are lots of ways that you can help us. I can see a few comments in the chat. Very interesting. Have to go now. Sorry about that. Yeah, we are coming to the end of our hour. Really, thank you so much for the comments. If you have got any questions, we have got about 3 minutes left. I'm really pleased that people are finding it useful. If anybody wants to put their hand up, we probably have got time if people find that better.
Yeah, I think we've got one hand up, Helen. I think it's somebody called Stuart.
Okay, Stuart, do you want to take yourself off of mute and let us know?
Yeah, can you hear me?
I can't hear you, yeah.
Yeah, thanks, Helen, and thanks to all the presenters. Really, really interesting. Just a comment to Trevor. I can't only just remember the iPod, I can remember the Walkman as well. So, kind of, so that goes back. But so I'm on secondment from NHS Grampian, where my substantive post is. I'm a nurse to background, but an operational manager there to Scottish Government, working in the chronic pain policy team. And I was just interested in the fact sheet. So I had a look at the website during the discussion. And it's interesting what Trevor, since they only send out about certain conditions, and I saw back pain and headache was on it, but chronic pain wasn't something that was on there. And I know you can't include everything. I just wondered if that was something that was considered by the forum, or if you signpost to other areas if people get in contact with chronic pain, because it's such a big problem across the UK.
Well, now I'm going to say maybe you want to work with us and do one on chronic pain, because I completely agree. And we're always open for suggestions for new fact sheets. As you can see, we've expanded it. We do often need funding to develop a fact sheet, because obviously it does take a lot of time to do. But if you've got any suggestions, contact my colleague Libby on the Self-Care Forum, and we'd be happy to pick that up with you. But I agree, I think chronic pain is a really sort of big issue. One of my other jobs is working with long COVID, and people sort of like suffering from that. And I think it's and also I've done a lot of work with shingles, and we know that shingles has sometimes very long-term chronic pain management as well. So I think it is probably an area that could do with exploring. So maybe you can work with us, Stuart.
Yeah, no, please do. Okay, thank you very much.
But great comment there. So yeah, and just to say, do keep an eye on our website, because we constantly add to our resources, and sort of certainly we review them. We have a policy that we review them at least every 2 years, because obviously most of us coming from healthcare backgrounds, we want to make sure they are evidence based, and that's really important to us. So I'm just checking. I've got one other question from AJ. Are there any advice for encouraging teens and younger adults to be more involved in their self-care? And I think that's a really good question. I'm going to, if we've got time to go over a little bit, I'm going to ask first of all Addy to comment on that, and then maybe Pete.
Thank you very much. I think when we're looking at actually how do we get anybody involved in embracing any behavior, one of the things that I think Trevor has shown us is about using appropriate language and using appropriate insights into it and buying into the values that people already align to. Maybe for some, if you're younger, chronic long-term health may not necessarily be the thing that is on your mind, but actually there may be a sense more of instantaneous gain and instantaneous win there. Also, is also the collaborative sort of approach, getting it to be a community, family sort of endeavor could be there. But ultimately, it's also about information delivered appropriately, and the tone and the way that the fact sheets we design are set up is actually for that they are accessible and embraceable by everybody in that inclusive manner. So those are some of the things that I would think about.
Did you want to add anything, Pete?
I certainly do. Yeah. I mean, have a look at our website and have a look under Dr. Me. One of our board members called Chi Yin Fung has set up a most extraordinary system, and particularly using medical students and young doctors to go into schools and encourage people to think about their health. It's really wonderful, and it was started up with the Imperial and the Royal College of GPs. It covers most of the country now and is going to extend even further. It's such an important area. So do have a look at Dr. Me on our website.
Thank you, Pete. And Trev, you've got your hand up. You obviously as well got some thoughts. You need to take yourself off of mute.
Yeah, very quickly, I would say build it into a routine. So Addy's point to whether it's the family or the community, build it into a routine, but also think about that pyramid I showed you. Is it lazy? Is it confused? Or is it fear? Is what's the barrier to them not doing it now, and to really understand that.
Yeah, thank you for that. I've got one more question. Pete, do you mind if I ask the other question? I think it's quite important because somebody has put about people who've got ME or fibromyalgia and long COVID, housebound and not able to visit pharmacies. And I think that's a sort of question really, and links to some of the stuff that we've talked about having this stuff available on the website so that people can access. And of course, self-care isn't just about what the individual does, it's also about what those around you can do to support. So I think, the fact sheets are certainly intended to be used by others around as well to support. And I think as well, the other thing that some of the surveys around this have come up with is that people trust when websites and resources are from reputable organisations, and understanding where that comes from is really important. And I think, one of the things that we can be assured of, I said, our fact sheets, we have a 2-yearly at least review of our fact sheets. So you can be assured that they come from an evidence base. And I think that's really important to be able to reassure people. Sorry, Pete, did you want to say anything else?
It was really, there's another question in the chat, which is about using this webinar in a self-care day. I don't see why that shouldn't be the case. We're actually going to be running another one of these in October as well. I just thought it would be worthwhile mentioning that as well.
I was completely agree. I was going to actually suggest to Eileen that maybe you could also email Libby and we could sort of work out that for you. Yeah. But the website will, the video and the slides will be available on the website as well. So yeah, great. thank you so much, everybody. I am going to have to close it. We're 5 minutes over, but obviously a lot to say. And so thank you very much. I've got one more new message. Oh no, will do. Thanks. Okay, that's great. So thank you again, and goodbye. We'll see you again, hopefully sometime, Self-Care Week and everything. But thank you.
Thank you for coming. See you.
Bye.
Thank you.